Hi Janice, Ziv Simon here, and together with Dr. Alex Waldman, we wanted to thank you for coming to the Dental Hygiene Study Club meeting 2 weeks ago. We hope you enjoyed it. We always love having you and interacting with you, and we look forward to putting more and more meetings throughout the years, and give us some suggestions on what type of topics you'd like to hear about, and we will make it happen for you. We are now aiming for February 24th, 2016, and we look forward to having Pam Hughes lecture to us, and she's an awesome speaker, and I know you enjoyed her lecture last time, so we're looking forward to having her back. In the last meeting, I talked to you about how to deal with complications during your dental hygiene appointment that have to do with your instruments and with local anesthesia, and these things are part of the treatment. Luckily, they're infrequent. And what I found out over many years of dealing with complications is that there is a repeated storyline when these happen, and I described it to you during the lecture. So complications do happen, and we talked about what can go wrong and a little bit of an explanation why it went wrong, and also what to do. Now, the what to do was two parts. It was what to do clinically, meaning what's the next step and how to address the situation, but also how to talk to the patient, how to deliver the bad news, and how to diffuse these tricky situations when patients can get upset, and how to come on top even if something bad happened. I talked to you about complications coming from your instruments and from local anesthesia. I showed you some problems like a hematoma after an injection and even after taking impressions, and we talked about how to manage, how to say it, meaning what is the exact verbiage you're going to use when you speak to your patients. And I showed you the CUPP technique that is really simple, and it helped me over the years to overcome these situations. We talked about some nerve damage issues, like the lingual nerve. I showed you the passage of the nerves, and of course we have to be careful when we do surgery in this area, but when you give an injection, there's a very small chance that you'll cause some nerve damage, which is a tricky situation for you and the doctor you're working with. Luckily it's rare, and there are some medical legal implications, and as we talked about, there are some good ways to manage and diffuse this situation. I showed you a condition called air emphysema, which is basically a collection of air in the interstitial tissues. CUPP technique is going to help you manage the patient and help you communicate and make sure that they don't get upset, and I want you to CUPP your patients. It's going to help you tremendously. Then we went over some cases of broken instruments, mostly curettes that have been sharpened too much and the tip broke, and what's the protocol on that. We talked about the importance of x-rays during this process of diagnosing what happened and locating the broken instrument, and also after you removed it to make sure that it's gone. I also talked to you about what to do when a crown comes off during a cleaning, and what is the course of action, what are the different steps. And even more difficult is how to deliver the bad news, what to say, what not to say, and you guys had great suggestions and talked a little bit about your experience, and that was really helpful to me to get your point of view. And then I talked to you about the repeating storyline when a problem happens and you're dealing with a complication during treatment, and what are the different steps all the way to the resolution. And this storyline again keeps repeating just from my own experience over the years dealing with these types of problems. So I hope you enjoyed it, and on behalf of Dr. Alex Waldman and myself, we wish you happy holidays, a happy new year. We're looking forward to seeing you in the new year. Our next lecture is February 24th. We're hoping to have Pam Hughes lecture to us, and you'll get a separate invitation. All our best, and see you in 2016.